was saying, the Digital Boards programme is designed to support NHS Trust boards lead the digital transformation agenda, and NHS Providers has partnered with Public Digital to deliver it, and it's also supported by Health Education England and NHSX. And my colleague Adam from NHS Providers is going to give you a bit of a flavour of what's coming next in the programme towards the end of the session. The session today, as I say, is on digital inclusion, and this is a really, really key topic. There's been loads of interest in the session, and the board development sessions as part of the digital boards program we've been running. I think this topic comes up in pretty much every one, so it really is on the minds of a lot of NHS Trust boards. So team thought it would be good to take the time to have take a deeper dive into the topic and really consider it and reflect on it a bit more deeply, and hear from you and your peers about digital inclusion. To tie in with the event today, the team has launched a digital download briefing for board leaders that captures some pointers on digital inclusion. So we'll share that with you after the session, and that will be published on the NHS Providers website as well. It's great to see so many of you joining the call today for this discussion. There are a lot of us here, so up to 53 in the participant list at the moment, which is great. Just to give you an idea of who's in the virtual room, we've got a mix of exec directors, non-exec directors from mental health, ambulance, community and acute trusts as well. Now, I want to introduce some of our speakers. Now, speaking as a middle-aged white male who works in technology, I'm the absolute worst person you could hope to hear from on this topic. But luckily, we've got an absolute fantastic panel today, and I'm thrilled to welcome Helen Milner OBE, who's the Group Chief Executive of the Good Things Foundation, Denise Sterling, a non-exec director at Calderdale and Huddersfield NHS Foundation Trust, and Victoria Betton, an entrepreneur, writer, and currently MD of PeopleDotCom. Now, just to explain how this session is going to work. So in a moment, I'm going to hand over to our panelists to allow them to briefly introduce themselves for a couple of minutes each, just to explain who they are and their role. Then we want to get straight into the discussion and the debate. So I'm going to be leading off with just a few questions, but from this point on, I would encourage you to start thinking of things you'd like to discuss, you'd like to ask the panel, and just type those questions straight into the chat window. I'm sure you're all well versed in all of these video platforms now, but you can access the chat in the toolbar just at the bottom of the screen. So please do submit your questions there, and we'll get through as many of those as possible. If you have any trouble, just stick your hand up or put a message in the chat, and part of the production team will help you. We're going to finish, apologies for the barking dog outside the window. We're going to finish at 1:30 promptly. As I said, I was going to mention the video recording as a final point to add that because there's been so much demand for the session, we're going to record today's session, and we're going to assume by staying in the meeting that you consent to this. Just to be clear, we're not publishing this openly. It's only going to be available on demand to NHS Providers members for those people who've missed it. As I say, there's been a lot of interest. Okay, fantastic. I think that's all the housekeeping done. So let's do quick introductions from the panel, and I'm going to hand first to, let's do this in the order of Denise, Victoria, Helen. So over to you, Denise.
Thank you. Good afternoon, everyone. My name is Denise Sterling, and I'm non-executive director at Calderdale and Huddersfield Foundation Trust, and I'm very pleased to join you in this meeting today. I'm by no means an expert, but I'm looking forward to engaging in discussion with all of you.
Okay, thank you. Hi, everybody. Really delighted to be here today. My name's Victoria Betton. My background in the NHS, I worked in the NHS for 20 plus years in various sort of PPI strategy innovation roles. In the last sort of 7 years, I ran a digital health consultancy that was a business unit within an NHS trust called Habitat. I then went to work for the tech sector, and now I'm running my own company, helping the NHS sort of introduce service design and do digital strategy. This subject is really, really close to my heart. I wrote a book a few years ago now, which was a guide for practitioners about how to work with young people around their use of technology. And that's where I really noticed a dissonance between some of the assumptions around young people's use of technology and then what it actually was like for them. So I co-wrote that with a psychiatrist. And then I've got a book out, it's going to come out in the autumn, called Towards a Digital Ecology, bit of a tongue twister. And that's about digital transformation of the NHS through the lens of COVID. And I wrote a chapter about sort of digital exclusion and interviewed at least one of Helen's team as part of that book. So yeah, I've been thinking about this quite a bit, I guess. But like Denise, I'm not an expert, but it is something that I'm very passionate about. Thank you.
So hi, so I'm Helen Milner from Good Things Foundation. So Good Things Foundation is a digital inclusion charity. So I think I'll say I am an expert in digital inclusion. So I think hopefully I'll bring that angle to the conversation today. Good Things Foundation, we work all across the UK and also in Australia. And we work with thousands of community organisations, public libraries, small local charities, GP practices, NHS trusts, social housing providers, local authorities. We even have a fish and chip shop that is one of our partners in Stockport. The model is that I call it a big club with a shared vision. It's not a franchise, it's free to join. And so it's very much about creating a movement for digital inclusion. We turned 10 in December, and for 6 of those years, we've been working with NHS England on a programme called the Widening Digital Participation Programme, which I also find a bit of a tongue twister. And that's working both with the formal health system, but also informal health, around helping people have access to digital, but also using digital to help people to self-manage and empower, and to realise those wider health and wellbeing benefits that being included in a digital society brings. Just some stats, I'll give you some more if you want later, but at the moment, so this is the new data that was out in May, there's 2.6 million people who have never used the internet in the UK, and there's 14.9 million people, so 14.9 million people who are low internet users. So that means they use it infrequently, or they use it in a very basic way. They might have a mobile phone, they may shop online, they probably don't use email. Right? So that's the level of those 14.9 million people. The good news from the pandemic, if there is any, is 1.5 million people actually came online for the first time. So the pandemic was a big motivator to shift that number. So that shifted the 2.6 million number. So that was 1.5 million more a year ago. So it's been good news in that way, but actually there's clearly still millions of people left behind. So I'm really interested in that blend between using digital inclusion to help people have those wider benefits, as well as working directly with the formal health system.
Brilliant. And thank you, Helen. Thank you for those stats, which I think were the perfect scene setter for the discussion. So to the audience, please do start typing in the questions that you'd like to get into. But I want to lead us off, Denise, and if I could turn to you. And as I mentioned earlier, digital inclusion is something that trusts are raising in all of the sessions that we're doing with them. Given your experience and viewpoint at Calderdale and Huddersfield, how do you think how do you think board leaders should kind of get started in getting to grips with this topic?
Yes, well, I think where we currently are at the moment, it is certainly at the forefront. As you said, you've been in lots of discussions with various individuals working across the country in different trusts. And it is something now that is right at the forefront. And for me, my personal view is that we need to take stock. Trusts across the country will be at different points on the journey, on the digital journey. And so we need to take stock. And I would say that from a patient's perspective, we need to understand, if we haven't done that recently, we need to understand the patient population demographics, what information is available, and what is it telling us? What is the information that we have? What is it telling us? For me, that would be a starting point to identify the areas most in need in your locality. And if I talk about the position at Calderdale, we found using the data that we had available invaluable. There appears to be sufficient information to suggest that digital inclusion also leads to worse and can lead to worse health outcomes. And so what we've done, analysing the data and using the index of multiple deprivation, we've been able to look more holistically at the patient groups and prioritise our waiting list on need. So that's one thing in terms of, what should we be doing? And then from a point of view of staff, for all of us in all our different organisations, there are varying levels of skills and knowledge. And it's essential that our staff are comfortable in using all of the available digital tools, so that appropriate services and support is being provided for patients and for service users. And so this is an opportunity for taking stock to identify the skill gaps and to see what investment is going to be necessary in terms of developing the digital capabilities of our staff. And what have we learned in the past 15 months to aid our understanding of digital exclusion? Again, from my experience, through involvement of colleagues, partner organisations, members of the public, we've identified a number of learning themes where new ways of working that we implemented during the pandemic, had potential for long-term benefits and should be sustained and further developed. And so, under that particular theme of work, which we're calling business better than usual, we've identified themes that are linked to digital inclusion and for ongoing work. And I'll stop there.
That's great. Thank you, Denise. Covered a lot of ground there. I was quite struck by, the sort of the need for digital to actually give you the data to start to understand your population. So there's quite a relationship there, isn't there? You mentioned building the skills and knowledge of staff. I'm interested, can you give us a flavour of the kind of things you've kind of got up to there and what you've seen work and be useful in Calderdale and Huddersfield or elsewhere?
Is that in terms of the training or how we've been using?
Yeah, in terms of, as you mentioned, sort of skill, building skills and knowledge in there.
Yes. Well, at the moment, for example, one of the things that we're doing, we decided that we really needed to increase visibility, particularly for non-executive directors. And we started to have a conversation a little while ago about how we could do this. And we wanted to actually engage with patients on the ward to actually get a sense of the patient experience and to have a look through the patient's lens, how, the services that they're accessing and etc. And so on the back of that, we have been involved in a piece of work using a standardized model that is now being used across the country in different trusts. We've developed a training package, and that is to training in the use of the tool, but also to have the support from a clinical individual to actually walk us through a ward and to do the basics with the kit.
Yeah.
So that's one thing that we've done. Another very quick example is that when we introduced new EPR system, there was the opportunity with using this to have a digital observation tool, which meant that this tool would notify if a patient was deteriorating. And so that meant that healthcare assistants, doctors, nurses were able to use this tool and actually to gain confidence, particularly for those staff like myself, who's not that digitally savvy, to actually gain that confidence and actually to realise that using this bit of kit makes their life much easier. So actually we had a double whammy with that in terms of individuals becoming more confident but also seeing the benefit and getting the training and development and using that.
Brilliant. Yeah, I can see the virtuous cycle there for sure. Helen, Denise mentioned the link between health outcomes and digital inclusion, exclusion. I don't know. I wondered if you had a reflection on that point, or more broadly on anything Denise has said. Yeah,
definitely. So on health outcomes, we know that the people who are most likely to be digitally excluded are also most likely to be socially excluded. Mm-hmm. So that many others who are probably more expert in the combination have said that digital exclusion is actually a super determinant of poor health outcomes. And so that actually that it's important to understand that digital exclusion compounds social challenges and compounds social exclusion. And also that, I mean, I'm sure everyone on this call today understands that people who are older and who are poorer are much more likely to have poorer health outcomes. So that it's not a surprise, therefore, that many patients who have complex health conditions may also be digitally excluded. So that's about the interplay. But we also know that by helping, so through the work that we do, and I think this is particularly because we have all these community partners and other partners who are providing that hand-holding help on the ground, that and then we also have an online learning platform called Learn My Way. And this technique of this blended learning, incredibly supportive, very informal, but people actually are learning skills, but they're also getting confidence and self-efficacy, they're getting better agency, so it's not just about you have the skill to go on the internet and search for something, and then you have that bit of information. It's much more transformative than that. And therefore, if you're helping people have that self-efficacy and that agency, then you're actually helping them to see as a whole person, to see themselves as a whole person, and therefore to see their pathways to better health themselves and understanding that. Going back to the question though about where to start, Chris, and I think that what I really want to say is that that digital exclusion is, yes, it's about devices, and we've talked a lot about devices during the pandemic, and happy to talk about that. So people just don't have a device, and when all of the public places were closed, the libraries, the community centres that provided free Wi-Fi, McDonald's and coffee shops as well, then actually that became incredibly critical, and a problem that was hidden became very, very apparent. You also need to have access to the internet, affordable, good quality access to the internet, either fixed line or mobile. And again, I can say more about that. And we've actually set up a data poverty lab to try and end data poverty. And then we've already mentioned skills. So you need skills, confidence. But then we also put a fourth thing that in this mix is about purpose. So why do you want to use it? Why are you going to continue to use it? What are your goals? Because actually there's no point in having any of the other three unless you're going to be using it in your daily life and you're using it in a way that's helping you and benefiting your life. So I think quite often when I'm talking about digital inclusion, people think, I definitely don't think this audience will be thinking this, but they're thinking it's about, downloading, streaming Netflix or ordering a pizza online. Actually, this is much, much more fundamental. And in health is one of those ways in which there's a fundamental difference between your life as an internet user and your life without it.
Thank you, Helen. Victoria, I know you've been looking at, we've talked about sort of outcomes and the kind of social determinants of health and their links, and potentially has been impacted further during the pandemic. And I just wondered if you had a reflection from that angle, and again, anything about where you would think a good place to get started is for boards.
I think just building on Helen's point, I just want to reinforce what Helen said really, which is NHS trusts, I think, need to be not just thinking about we want people to be digitally included so they can use digital tools that we want to prescribe for them, or we want them to use to self-manage or self-service. This is about digital inclusion as an enabler of better health and well-being, through being more included, being able to engage with communities, with accessing resources and so on. So I think it's really important that boards approach this in a really holistic, open way, thinking about social determinants rather than we want someone to use a particular digital tool or app. I mean, COVID, the reason I started writing the book in COVID was just like, gosh, if this isn't an inflection point for digital, I don't know what is. And whilst, you know, I mean, one of the things that really interested me about COVID was just how suddenly digital poverty and digital exclusion suddenly was on everyone's radar after decades of going to conferences where people go, oh, everyone's got a mobile phone these days, to suddenly going, oh my God. And I think it was actually children in schools. I don't know whether you agree, Helen, but children not being able to engage in schools, for example, that really hit home about just the impact of digital poverty. So, I mean, in terms of where to start, I think so. COVID's been a real sort of eye opener, and I think it's forced the issue in a way that maybe it wasn't forced before, which is a good thing. I think it's really important that boards engage with this topic in a really strategic way as an enabler of their wider objectives and vision, particularly for digital transformation and beyond. This isn't just an add-on. This isn't something they don't have to pay attention to. It must be strategic. There are methods and approaches that I'm sure we'll get into that can enable you to do this in a sort of cohesive way. And Denise talked about gathering data as a starting point. I also think this is something that boards can't do on their own. I think this is about partnerships. I think it's about working with local authorities, it's about working with charities, it's working with civil society, but it's also not expecting them to do it, but the NHS playing its role. And when I say it, each NHS organisation, maybe as anchor institutions, playing a role in contributing your resources and assets. And I think there's no better place to start, actually, than to find out what assets you do have in your locality, within your organisation, within your region. At the very least, you'll have a load of Good Things Foundation stuff going on that you can build on. But start somewhere, however small it is. Build on the energy that you've got locally. Connect it to your strategic ambition, and then use methods to help you to get there. But it mustn't be an add-on. It mustn't be an afterthought. And it does need to be sort of holistic and inclusive. And as Denise said, we really need to be paying attention to the digital confidence of staff, and them having the right infrastructure as well, because it's often the dissonance between the promise of AI and digital innovation and then the fact that people have to log in 15 times or their laptop won't stay charged when they're out in the community. That's what kills the love of digital for a lot of frontline practitioners.
Yeah, couldn't agree more with that last point, Victoria. So thank you. So I really want to get us back into methods and approaches and actually what's worked, some good practice and ideas, because I'm sure that's what the audience really want to hear. I'm going to go just into the chat window though, because there've been some good sort of comments and questions coming through. And Mark, you were first out of the blocks, and I wonder it'd be nice maybe if you can come off mute and perhaps just express your question so we can hear it direct, and then have give it some thought together.
Yeah, I mean, I'm come at this as a non-exec director now, but I'm an ex-NHS CIO. In fact, I worked at CNWL, and I see from one of the other comments there's good stuff going on at CNWL. Hi. For me, there's a lot of so at the trust I'm at currently, I did a piece of work for them and recommended they set up a digital board, a digital committee as a subcommittee of the board, and hire a professional chief digital information officer, which they've done. Which is good. And engaging with the trust, I mean, the trust is very open. It always talks to its service users and carers as well. We're a mental health and community trust. And a lot of the conversation about digital inclusion is more about offering multitude of services. So the important thing from our point of view is that there mustn't be only a digital option. You still have to retain the services. And in fact, I chaired the digital committee yesterday, and we had the first reading of the new digital strategy. And one of the key things there was a lot of people had commented on the digital strategy that the really important thing in some areas is you have to have face-to-face. That doesn't mean to say you don't have digital methods to help you whilst you're there, like access to medical records whilst you're on the move, all of that good stuff. but is not to get completely overrun by digital, but recognise there are certain areas where one size doesn't fit all. And that brings us on to the question I had in the chat was, no matter how well you design all of that and how well it works, there are still hard to reach groups. And I guess it's the never-ending question is, how do you break into those hard to reach groups? I'm interested to hear if anybody else has got any experience of those, because there will always be people that aren't aware of the services and don't know how to engage with them.
Thank you, Mark. I feel like this question is very much in your wheelhouse, Helen. So I don't know if you want to give some views on some of the projects that Good Things Foundation have done.
Yeah, definitely. So fundamental to our model, as I was saying, is that we have these thousands of community organisations, and that they reach those hard to reach groups because they are an organisation supporting Bangladeshi women in Birmingham, or they're an organisation supporting pensioners in St Albans. And the beautiful thing about it is they reflect those groups that they're supporting. If you indulge me, I want to tell you a little story about a skills minister once visited one of our centres, and he asked the woman who ran it, he said, "How do you reach these hard to reach people?" And she said, "What do you mean?" And he said, "Well, I've just been here a few hours and I've met someone who's a recovering drug addict. I've met a couple of single parents. I've met a guy who's just come out of prison. How do you reach these hard to reach people?" And she just looked at him and she said, "They live on this street." Right. And so that's what our model is all about. And afterwards, actually, she said to me, "Did I give him the wrong answer?" And I said, "No, you gave him the perfect answer, because they're not hard to reach to you because they live on your street." One of the solutions that we've developed through the Widening Digital Participation Programme, and we're now just coming to the end of a second pilot funded by RB, the health and wellbeing brand, is we call them digital health hubs. So this is about creating, supporting community centres to work alongside the formal health system. So very much that community centre is engaging the hard to reach because they live there and they're the people that they're supporting every day. But then engaging them through digital health literacy, we call it. So that's about supporting people to do their digital literacy, and then adding on to the end of that learner journey, learning about how to engage with online tools and the NHS website, etc. And then through, I like to think of it as both bonding and bridging between that informal community setting where you're actually helping people to engage with health services through online, but then linking within the formal system. So one example of this is that there's a really terrific, one of our partners and is also a digital health hub in Leeds, a Crossgates neighbourhood partnership. They have a dementia cafe. During the pandemic, they've actually been running that dementia cafe online. But instead of someone noticing that somebody was finding it a bit tougher this week than they did last week, and then sending them to the GP now actually comes to that health hub once a month to sit and have lunch with them. And then the volunteers and the staff there can say, actually, we think Fred might be not feeling so great. Could you just make sure that you maybe sit next to Fred, and while you're having your lunch, and have a bit of a chat? So it's bringing the formal and the informal together. And of course, you might say, well, what's that got to do with digital? But of course, within the Dementia Cafe, they're using tools, and they're using things like YouTube to help people to talk about some of their favorite songs from their youth, and then showing them how they can search for that on the internet. And obviously that's incredibly good for their mental health, because that's about bringing back the memories that they can remember, and actually reinforcing that there is those positive things, that those positive memories that they do still have. So again, that's about that embedding. So that digital health hub, that bonding and bridging, and I think that's also about recognizing. And Victoria, you said it already about the people within your ecosystem, those organisations within your ecosystem, recognizing that not all health solutions are being led and run by the NHS. You know, that actually out there in the informal ecosystem, there'll be some really great activities, and digital inclusion is part of that. That is helping people with their health and well-being. So actually, maybe it's about them not being hard to reach. Maybe it's about you not reaching out to them. So, you know, that's what I would say. And there's some examples from our work.
Thank you. I mean, that's really useful. I think one of the key things to take away from this is that the digital tools, if used properly, should enable more face time with patients. I think earlier versions of digital, you sent people out with laptops and they spent a lot of their time in front of the patient looking at the computer.
Mm-hmm.
These days, it's hopefully a lot different than that.
Yeah, indeed. Thank you, Helen, for those inspiring examples. I mean, Denise, just to bring you in from a trust perspective, is there anything you would reflect on in terms of, you know, extending that reach, as Mark has asked? Anything that you've seen work particularly well, or conversely not work well?
Mm-hmm.
Yeah, I think that Mark's absolutely correct about the fact that we can't. It's not one size doesn't fit all, and even though we do have digital solutions, we also have to be mindful that there are other people who are unable, or as well as being unable, there's also another group who actively don't want to engage, and so we need to take all of that into account to ensure that we get an appropriate balance. I think what we have, I think what works, again, you know, if we start and if we remember that this is about people, be it patients, service users, or staff, it's about people. And actually, one of the things that we found is ensuring that you're doing that engagement piece to actually find out, you know, instead of, you know, again, as the professionals, we're the ones who are saying this is what you need and this is what you're getting. Actually get them in and talk to them and find out what is it that you need, what would help you, you know, access the service. What are the things that really irritate you? What could we do differently? And actually get those viewpoints to help to really inform how we then provide services in a way that they can access. And again, one of the things that we need to, and you know, we've acknowledged ourselves as a trust that we need to do more. And again, it's the engagement piece, as Victoria said, that, you know, we can't do it in isolation. We have to engage with our partners in the wider system, and actually ensure that we have this as it's a shared agenda. It's, you know, it's not just one area, it's the whole system's agenda. We need to ensure that we're all singing from the same hymn sheet and pooling our resources and our experiences in a way to make the most effective use of what we have. One of the things we know we don't do as well as we should, and that is something that we are addressing, is out in the community and developing more community hubs. You know, what can we put into that to ensure that we're supporting? And again, going back to Victoria, you're absolutely right to say that, you know, we need to, particularly for those of us in large trusts, need to think about our input and what that input could do that impacts the community more effectively.
Yeah.
And I think just if I could just come in and build on Denise's point, I think these relationships have to be founded on trust and like long-term relationships. So I think, you know, the community organisations that Helen sort of referred to have often built up those relationships over many years with communities who might be feel quite excluded and are less reached by NHS services. And actually, those are really important relationships. And I have seen in the past NHS organisations come in and sort of want to take from those communities, but not necessarily want to invest in building that relationship. So I just sort of emphasize that there aren't quick fixes here. This is about long-term relationships, and being sensitive to and responsive to community development approaches, and about working with communities over periods of time. And I think, you reap the benefits in the long run. And I think the ICPs are really lending themselves to that much more collegiate and collaborative way of working. So I think the context is starting to change in the right direction for that. Those sort of relationships.
Absolutely, thanks, Victoria. Useful policy direction there to help manage some of those issues. And Denise, back to your points, it sounded like a real call for, as you said, involving users and that co-participation, and involving sort of user-centered design type approaches is certainly a way that, as Public Digital, we'd champion as a way of managing some of these issues as well. So thank you very much for that. I'm going to move us back to the chat window, and I'd want to pick up Jude's a comment, which I'll probably ask you to reflect on first, Victoria, to give you a heads up. But Jude, do you want to come into the discussion and talk about children and young people, perhaps? If you're there, Jude. We've still got you. Still on mute, Jude.
Can you hear me now?
There we go.
I'm sorry, Zoom does different things to my computer. Thank you. It's a really interesting discussion, and a lot of the conversation so far has been particularly around adults and leading towards elderly. I work in a specialist children's organisation, so our time and thinking is all around children and in their families. There was a reference earlier to the impact of schools last year, wasn't there? And that. So I guess I'm curious as to where we can work within communities with families, particularly around children, where we know that we don't always directly communicate with the children and young people. It's also with their family and their carers. And so I suppose we've got a few, I guess, maybe additional considerations that we need to think about with that. And I think the easy and lazy answer is to think that children know what they're doing with technology. So therefore, that's less of a problem. I think what we experience is a really wide continuum. There's those that are really connected, and that's what they want, and they want an app to be able to talk to their therapist. And then there's others that are the other end of the spectrum, and they really struggle to access. So I guess I'm just interested to see, is there any variation in approach and how we might be able to work with children and young people in a better way?
Shall I pick that up then, Chris? I'm happy to start off. So when I wrote that book a few years ago, I was really aware that adult voices really sort of dominate. I mean, less so now. I think there's a lot more. And the work of Sonia Livingston and Parenting for a Digital Future is absolutely where you should look at London School of Economics. Her work is amazing. I think you're right that there's been this sort of all young people are digital natives and all adults are digital immigrants. And notwithstanding that is a very problematic metaphor anyway, it also doesn't reflect reality. And Helen talked about those social determinants around sort of poverty and exclusion affecting people's use of digital, and it's exactly the same for young people. So when I was doing all my interviews with young people and looking at the evidence, you had examples of young people with flashy phones, but they didn't have data, or they were sharing a phone between a number of different family members. They might have a phone, but they didn't have a laptop, so it was really hard to do their schoolwork. So it was really nuanced when you looked into it. But also, I mean, my book was particularly about mental health, and young people were often using the internet in ways that adults didn't understand or appreciate in a positive way for their mental health. So a lot of young people talked about gaming as a way of distraction from troubling feelings, or for self-efficacy. Well, I feel good about myself because this is something I'm good at. But then their parents would be telling them off for being on the computer again. So I guess for me, I think the really important orientation for practitioners working with children, young people, is to take that sort of like coaching ally approach and really seeking to understand their context, what's important to them, how they use technology, but doing it in a way that isn't a prying way, but is in an interested, I want to understand you so I can support you, encouraging way. So that's the orientation I would have. And I think we should be building it into our assessments, not in a tick box way, but in a genuinely seeking to understand the nuances of every young person's context. And then the other thing we found was that actually sometimes the young person did want a letter. If it was a really important bit of information, they would like a letter that they can fold up and put next to their bed. But sometimes they'd want a text message, and that would be more appropriate, or they'd want to communicate through an app. There was a great example of a CAM service that I was working with, and for I think children over 14, they were ringing them to do the first appointment after they'd been referred to do the first appointment. And if it went to voicemail, and they could catch them after school but before 5 o'clock, if the young person didn't answer, then they would basically get pushed out, and they didn't respond. But the young people were like, well, we don't pick up those messages because we don't have enough data, or actually I never answer the phone to anyone, so why would I answer the phone to this unknown number? So these were really nuanced, tiny things, but these were young people not getting connected into services because they were receiving a call from an unknown number. So Chris very briefly mentioned service design, and I hope we'll talk a bit more about this, but this is, we need to be designing digital services with and for the people they're designed for, current users and future users. And I think if you take that systematic approach, then you're not going to go too wrong. But making assumptions is the biggest problem, because it is nuanced and it is context specific.
Yeah, thanks very much, Victoria. And Helen, I'm going to come to you for a reflection on children and young people as well in a moment. But Andy Willis in the chat, sounds like you're doing some work in this area. So I wondered if you wanted to jump on and just tell us a bit about that.
Yeah, thank you. I think it's probably early days, but yeah, I just wanted to flag that that we are generating some research. So we're a community provider, cover London and Herts. Our children's services have really used virtual heavily over COVID, much more than the adult services. So we've got quite a lot in terms of throughput. We've had individual services have done sort of small point studies on how it's gone down with service users, and it's generally been quite positive. But we were recently approached by UCL about doing some research into how the sort of patients' attitudes and staff's attitudes to using digital, and also helping to do an evaluation. So we're just at the point of kicking that off. It's going to be a couple of months down the line, but I just mentioned to Judith, who's interested, I'm happy to share the planning. If there's anything, please feel free to chip in on that. And equally, I can share the results, and same for anyone else. I'll put my email in the chat. So if you are interested in seeing that, as I said, it's going to be a couple of months down the line, but anyone is more than welcome. I'm happy to share.
Sounds really helpful, Andy. Thank you very much. Helen, any thoughts on this topic?
Absolutely want to reinforce what Victoria said, that don't expect all young people to know how to use technology. That one thing, though, I also wanted to say is that there's been an eye-watering response to the fact that there were so many children in poverty who couldn't access school during the pandemic. And that has resulted in 1.3 million children having access to devices from government funding. The Daily Mail's got £1 million worth of devices out to children. Our numbers are small in comparison. We supported 3,500 families with device and connectivity during the pandemic. And so there's a little bit of my brain that says, so are there any children left who don't have access to technology? So I think it would be really good to, as a starting point, assume that actually most children who 12 months ago did not have technology should have technology. And if they don't, I would be asking them to ask the school, why don't they have access to this technology? Because that's definitely a massive shift, and therefore I think we should shift our expectations that children and families therefore should have access to this kit. Just to little health warning is, I'm sure a lot of them don't have access to the kit, right? Is that there's been a lot of action, but we still hear a lot of stories about children and families not having the kit that they need. But let's be bold and say, so where are the 1.3 million laptops and tablets that the government has funded, and why are they not in the hands of children, young people and families? The other thing I want to say is that one of the things within the Widening Digital Participation Programme is we did a number of pathfinders, design-led, and one of them was with Islington, in Islington, the Young People's Mental Health Service, and what I'm going to be advocating here is around low tech. Is that don't think because they're children and they have smartphones, therefore you've got to design an app, right? Actually, what they found was the most useful, and this was all done designing with, not for, young people with mental health issues. That they actually, what worked for them was a PDF with their key, their techniques of dealing with anxiety and key numbers and contact numbers for people. It was a PDF that they all downloaded and had on their phone. Back to the data point that Victoria's talking about, that takes no data at all because you've already got it there. And then at that critical moment when they needed it, they knew they just went to that PDF on their phone and it had exactly what they needed at the right time. Incredibly cheap, but a perfect solution and designed with those young people and for those young people. So, don't think that you have to have a high-tech solution. Sometimes low-tech solutions could be better. And that's why designing, with your patient groups can actually maybe also help you save a lot of money.
Absolutely, Helen. And some of the examples we talk about in the board sessions, are about those, using basic technology to make leaps forward, such as applying content design to a letter that would otherwise be incomprehensible, causing a lot of stress and sort of isolating those who don't who have differing levels of literacy. So I think really, really important point there. I want to go to Leonard now, and Denise, I'll probably bring you in on this one because it's going to be, I think we're going to talk a bit about data and identifying different kind of being able to prioritize appropriately. So Leonard, do you want to come in and tell us a bit more about your digital empowerment and inclusion pilot?
Yeah, thanks, Chris. So CNWL works across obviously central and northwest London, and we've got this pilot where we are going out to identify digitally excluded patients, and we've got some devices, some laptops, mobile phones, tablets, data packages, digital volunteers providing training and support. And the three biggest challenges that we're facing is categorizing. And I think that's probably the easiest because, we can categorize, is it digital poverty? I don't have a device. Okay, here's a tablet. Is it data poverty? Yes, I've got a phone, even a smartphone, but I don't have internet at home and I don't have the data contract to have a Zoom call with my therapist with the video on for an hour a week. Is it digital literacy or is it technophobia? I don't want to use this. Bill Gates is spying on us and wants to steal my data or what have you. So the categorization, I think we've got some steps there, but then identifying, how do you identify someone who's not engaged in their healthcare because of digital exclusion? And I really like the example, Helen, about, the community outreach approach and working with partner organizations and the people on your street. But that's one of the biggest challenges because we're offering this to existing CNWL service users, but we have potential service users who aren't service users because they're digitally excluded. So that's one of the tricky parts, is identifying them. And then obviously prioritizing. We've got a limited amount of devices and resources for this pilot. How do we take health equality into the equation? If you've got X many devices and X to the power of 20 users who need these, how do we prioritize them? Do we prioritize all the people who are isolated? Do we prioritize young children? Do we prioritize people with psychosis or with eating disorders? Or it's really complex to try and make sure that it's an equitable split of the project resources.
Thanks, Leonard. Some super tough challenges there that you've raised, I have to say. And Denise, you mentioned in some of the opening questions around using, the data you've gathered and population health analytics to be able to do a bit of to gather some insights and prioritization. I just wondered if you had any reflections worth sharing with some of Leonard and the challenges he's facing.
Yeah, and what you've just described is it is a tough call in terms of prioritising, and what we've really tried to do is to have a really holistic look at all of the information, and to use that with the indices of deprivation to really try and use that as a way of identifying the greatest need, and so it's difficult. I don't think that I can come up with a solution to the problem, but certainly the way that we've been able to really dig into the data has helped us to come up with a different approach to the kind of the risk assessment to decide on who is at the top of the priority list in terms of, instead of date order, the referrals are coming over a week, and it seems to be working. I suppose the only other thing I would say, and I'm sure you're doing that already, in terms of how you use the scarce resources, is in terms of your team and your multidisciplinary team, and how you actually amongst yourselves come up with what you think are the priority areas. But it's not easy. It's really difficult.
Thanks, Denise. I'm going to come back to Victoria and Helen for a reflection on this one as well, so we can have a range of views. But Sheena, you had a suggestion in the chat as well. Did you want to just share that one and see if it sparks any ideas?
Yeah, thank you for that. Yeah, no, it was just occurring to me that, and it's some of the things that speakers have already mentioned around that collaboration and working with others, because this isn't just a challenge for health, is it? As we've already said, this is education, this is health inequalities in general, not just health inequalities. And there's lots of initiatives happening already, and thinking about the challenges that Leonard's mentioned around how do you access and how do you know and where do you target your support. I'm just wondering, particularly as we're being challenged to work in a much more collaborative way across systems, whether there's a way of tackling this in terms of a place-based approach, rather than trying to think about organisational boundaries where some of these issues might not be the challenges that we anticipate.
Yeah, I think that really underlines some of the points we've heard earlier from Victoria. But Helen, did you have any reflections on this one?
Yeah, absolutely. I think, Chin, I think you're spot on. I think a place-based approach and understanding your ecosystem and who you can work with, I think is absolutely right. I think, Leonard, going back to how do you prioritise, I would say you're saying in the chat panel you're running a pilot, right? You need to move from a pilot to a program, and from a program to system change and culture change. So if I was you, I would prioritise which staff do you have in CNLW who really get this, who don't just want to do a project, who want to change the way that they're delivering services and supporting vulnerable patients. So because actually use this as your wedge to actually get in and change the culture. So rather than saying you've got 20 patients right now who need support with devices, data and skills, actually say you want to change it so that you will never leave digitally excluded people behind again. And I would say make sure that you're really focusing on who are your champions, because you definitely are right. You can't help all of your digitally excluded people in your area. So get your internal champions and get them to really want to change the way that they're delivering their services today and sustainably for the future, and use this pilot and use the resources you've got to support them to make that change happen and make that change in a sustainable way. So that's my advice for you, Leonard.
100%.
Very, very, very practical advice there, Helen. I appreciate that. Victoria, any sort of reflections on this one before I move us on in the chat?
Well, Leonard and I are actually collaborating. We're working together on this. So
you know this one.
Yeah. Funnily enough, but I think Helen's advice is spot on, and what I'd noted down was iterate and be pragmatic. So rather than, I just think it'd be so hard, even though I love the idea of let's be really equitable with an unlimited resource, with limited capacity. I think finding where you can really get some benefit and lean into where there's the enthusiasm and the interest, but with that mind's eye, as Helen says, to future sustainability and how you can sustain this. I love the fact that you've got your volunteer coordinator with digital volunteers. So it's not just about the devices, it's also about providing support. And I think she has a little self-assessment as well. She has an assessment tool to use with people to understand what they might need support with. And again, that's not a one-off, is it? It's something you build through a relationship over a period of time with somebody. So yes, I'm looking forward to taking this advice and rebriefing with you next week, Leonard.
Brilliant.
We look forward to hearing back about the results as well. And I mean, I think being bold but starting small and iterate is a pattern that we would recommend across many areas of transformation. So no reason not to take that approach as well. Okay, I want to go to Louise. Is it Louisa or Louisa? Talking about your example in Dudley Libraries and your privacy kiosk. Do you want to come in with your question?
Hi, thanks for that. Actually, it's not yet an example, but we're working on it. And what we were trying to do, so whilst I'm a non-exec at East Kent, I'm also an exec at Dudley Council, so local authority. And we're working with the NHS and Dudley Council in Dudley to see about how we can work jointly on setting up digital places in libraries, but not just digital stations, but also digital kiosks, privacy kiosks. And the reason for the libraries is twofold. One is they've kind of got the space and they also want to attract people to come there, but also library staff tend to have that kind of helpful attitude and support, so that people that are coming there that haven't maybe got just simply the IT in their house, or they might be the people that are digitally excluded because they've got the smartphone, but maybe they don't feel comfortable using it to have an appointment or something. So it's about using the libraries as that place that not only provides the kit but also provides the support. But it goes back to a place-based approach and trying to work across the different organizations to find solutions. But we haven't implemented it yet. So if there's anybody else that's working on something similar, be glad for any insight.
Helen, any thoughts on any projects you've come across that have relevance?
Yeah, definitely. So specifically for libraries, we worked with, so in our Digital Health Hub programme, as part of Widening Digital Participation, Blackburn Library was a digital health hub, and that's on our website, so you can find out about all of the work there. And in our current project, we have the Millennium Library in Norwich. The really beautiful building is involved with the Digital Health Hub. The one I want to also point to is the very first digital health hub in the Widening Digital Participation Programme was in Nailsea. The council took over a shop that used to be a butcher's shop. And one of the things that they found was that actually people don't want to go in a kiosk and talk about their health, because it's back to that, how do you reach the hard to reach groups? How do you reach the people who you really want to reach, to have those conversations, to get that help? And so they put an A board outside and they wrote on the window saying, come in for a cuppa and a chat. And so it actually made it much more accessible. So it wasn't, are you ill? Do you want to talk to someone? Or, are you ill? Do you want to talk to someone and learn how to use the internet? It was, come in, have a cuppa and a chat. And then they actually found through having the conversation that people then, because they were saying that, they're going, what is this? This is about the council working around health, wellbeing and social care and wanting to have conversations with residents. They then began to talk about some of their health concerns and some of their health worries. And so I thought that might be just something that is really practical and helpful. But we also have things on our website about those library examples of the digital health hubs as well.
Thank you.
Yeah, thanks, Helen. Victoria or Denise, do you have any reflections on Louise's project?
Well, I would just reflect what Helen said about libraries are great places, and Leeds. I know Helen's worked with Leeds a lot. I've done a lot of work with Leeds libraries who just do great outreach and work through neighbourhood networks and so on. So something about how you can blend the assets that the council might have, and they will attract some people, but then how you can bridge those into then sort of activities happening within, local pubs, local community centres, and taking, I think it was my opening point really, about thinking about health in a really holistic and broad way, rather than in a narrow, we want someone to transact with us in this way. It's about how can we get the biggest impact, which is about that much broader sort of engagement where people are hooking into digital because it helps them achieve all sorts of things in their lives that make them feel good about themselves and well, rather than just transacting with services.
So obviously, the 5G was very enterprise focused.
Thank you.
Okay. Sorry, I thought that was a question coming in. Yeah. It sounds like it's just some background noise. And thanks for clarifying your comment in the chat, Sheena. I think she might have left now, but that really that really confused me for a moment. But I think we've cleared that one up. Okay, Andy, you asked a comment about kind of rationalising, standardising virtual platforms across a system. Based on the sort of the responses in the chat, I'm guessing the answer to that is no. But it's probably worth asking the question. If you want to come in on that one.
Yeah, absolutely. So I guess we're trying to reach people who aren't that tech savvy, and we're trying to reach them in the areas that I work with 4 or 5 different platforms. And I know Zoom and Teams and all the other ones are relatively similar, but they are all subtly different and they are all tricky. Sometimes you need to download an app. So a lot of the service users that we're talking about do access community, GP, acute, and social services. So they're having to learn 4 different platforms to access their services. Now, I'm leading on digital for our trust, and I struggle. I had a bit of a problem with Zoom this morning. I think we're asking a lot of people, and I think we could make it easier for people. If we could rationalise. I know Teams has been offered out to the NHS, and that will probably drive some changes. But I guess it's just sort of and one of our colleagues on the line mentioned hopefully ICSs will have some impact on this, and I think it would just be good to sort of work through if there are any examples where people have got success in getting people together and rationalising. That would be really, really helpful. For everyone, for patients and also staff, because staff tend to move between the different settings anyway. So this is a standard. Yeah. As staff, the level of digital ability I've been really surprised by. Like when you put out your job adverts, everyone has to sign to say that they've got a reasonable level of IT literacy. And certainly during COVID, we found out that it's pretty low. I think it'd be useful to keep them on board as well.
Yes, indeed. So, I mean, there's always kind of a trade-off when choosing these digital tools around level of customization versus standardization, whether you're talking about EPRs, video platforms, etc. I think you're right that, ICS is a potentially one route to get to that standardization. I haven't come across any examples of that being done successfully yet. I don't know if any of the panel have any thoughts on that particular topic.
It's just a consequence of the fragmented nature of the NHS and the fragmented nature of the digital health marketplace, unfortunately. So So I think I know of trusts who have got multiple platforms even within one organisation, never mind people having to bounce from one to the other depending on whether they're seeing their GP or secondary care. So I've not come across anything useful, I'm afraid.
Indeed. Tricky one.
Chris, I was just going to say, what a great question though, right?
Yeah. Really great question.
I mean, this is the fourth different video conferencing software I've used today, right?
Yeah.
And that and obviously all of the ones that are mentioned in your question there, Andy, are all kind of business type platforms, and you haven't put Zoom in there, and so actually Zoom seems to be the one that people and communities are using. So, back to go to where the people are rather than try and impose your models on them. If Zoom is the one that most people are using to communicate with their friends and their family, then maybe that's what the NHS ought to be using,
That's good telling.
So, but brilliant question, I think.
Yes.
Jim's just posted in the chat, and I think this is a good point as well around, actually the right tools to meet user needs. Jim, do you want to come in?
I'll try. Can you hear me?
Can hear you now. Yeah, thanks, Jim.
Yeah, sorry, I'm in the middle of a compromised space digitally, poverty maybe. It's just that, so we run 3 or 4 different platforms within our trust and across the system in Derbyshire. And that's because we do different things with different people and different groups. So we might do a group therapy session where Zoom is quite a good way of doing it, but an individual consultation we might do through something called AccuRx or through the TPP equivalent. So actually harmonizing into one platform may solve one problem, but opens up a whole world of other problems when you're trying to do different types of interaction. And I think, I suppose the analogy I remember, having gone out a few times in the last couple of weeks, I've been to various restaurants and pubs, and each one of them had a different way of ordering a drink or ordering a menu or whatever it was. I had to work through how to do that in order to do it. There's something around assisting people to use the best technology rather than trying to get everyone on the same platform and thinking that's going to solve the problem. I don't think it will necessarily. Thanks.
Thank you, Jim. And the other thing I suppose we would say and would say to clients is that, having some product and design expertise in your organization can help you select good products, because you can recognize the things off the shelf that will meet needs in the best way. And actually having that decision being taken by someone who is not close to users, not close to the action, who's not working in a multidisciplinary way alongside clinicians and operations, they're not going to make decisions on products that, that really help. And I think that's particularly apposite in the NHS when, there's a lot of buying of stuff going on rather than building or otherwise designing. So I think that's important.
Chris, one thing might also be, just when Jim was talking, is that maybe it's about having a standardized way that you ask someone to come to a video consultation. So if you always say get an email that has a link and you click on the link and that link opens in a browser, as an example, is then it doesn't really matter what platform is opening. I think the problems come where you have to, download software and, you need to have a Microsoft account, or, that actually potentially one way around it would be to standardize how people get that link. And how easy it is to use. Because if someone said to my mum, can I have a Zoom consultation, she'd say yes. If they said, can I have an AccuRx consultation, she'll say, oh my God, I have no idea what you're talking about. Right? If they actually said, if I send you a link to do a video chat in your email, she'd go, okay, that's fine. Right. So that, I think it's also about, it's back to that designing with the people piece, isn't it? It's like understanding what are your users going to do, and if you're making it the bit in the middle of how do you get your patient to the platform, if you don't get that bit right, it doesn't really matter what platform you're using.
And designing that whole flow, as Chris sort of intimated. So as you say, that sort of onboarding process, but also like what happens if it goes wrong and it fails, what's your backup plan, what happens at the end of, because they all have different affordances, each platform, and some of them mirror a clinical consultation more than others. It depends if you're doing group work. So I think doing that really good piece of user research and design where you map that journey with people and understand how it fits within a workflow, and for someone sort of, you know, sitting like I am today in my sitting room and going online, then that helps you make good decisions, I think.
You're absolutely right, Victoria. And I think the other thing, as I was just listening as you were talking, it's also about how we simplify things and our use of language, you know, because very often we overcomplicate and our language just makes it even more difficult for users to grapple with.
Yeah.
100% agree at that point, Denise. Okay, I can't see any other particular questions in the chat window, so I wanted to bring one in myself, which is obviously the Digital Boards program is based around helping boards get to grips with this agenda, and I'm really keen to understand, you know, what questions do you think boards, either execs or non-execs, should be asking of their organisations to know that they're kind of on the right track with this topic? And I'll leave that open, whoever wants to come in first.
I mean, I would start by saying, where do we want to be in 5 years' time? And, you know, the pandemic has exposed and exacerbated digital exclusion and has prevented patients getting services, but also the NHS has been amazing in inventing and creating digital solutions during this period of time as well. So in 5 years' time, then all of those benefits that we understand today and the ones that are coming along should be realised from a digital transformation point of view, and therefore leaving anybody behind is not acceptable. And so then to say, so what are the building blocks that we already have? And what are the ones that we don't have? And therefore, what's our 5-year plan to making that a reality? So I think it's really important to not say, let's have a project, because digital inclusion is a thing. Let's have a project to help 20 patients. It's like, where do we want to be in 5 years' time? Is it acceptable that people who are digitally excluded won't have access to our services? Is it acceptable that people who live in our area won't have those wider benefits of being digitally included? Therefore, what's our plan to get there?
And I would say, just building on that, I'd be asking, because no doubt each of your organisations will have a digital transformation programme, what's the digital inclusion element of every single digital transformation project that we have involved? What are the assets we have, as Helen said, that we can build on? Who are our partners that we can collaborate with and work with, but not just take from, but contribute to and partner with in the true sense of the word? And what methods are we using to make sure that we're systematic about understanding the needs of current and future users? And that's where Chris will like me referring to service design, user-centered design, which I know is Public Digital's thing, which is, you know, do really good discovery, user research, understand people's needs, users being your practitioners, administrators, as much as patients, carers and the public, and then iterating, understanding context, understanding nuance, and taking an iterative approach so that you're learning as you go. So there's really good methods out there, really good approaches that you can blend with the approaches that you currently have and work nicely alongside quality improvement, for example, patient and public involvement. But really, it is that embedded systematic approach. Like Helen said, it mustn't be a standalone project, and it needs to be properly resourced.
Thanks, Victoria. And Denise, a word from you.
Yeah, I would just add, because I think it's already been said, but how will you evidence that digital inclusion is included in all work programs? And, you know, what are the results that we're looking for? You know, are organisations clear about what they're looking for and to ensure that the results are outcome focused?
Brilliant. Thank you, Denise. Okay, so there aren't any other questions in the chat. So what I want to do now is, there have been lots of references to different projects and resources. So what I'm going to do outside the meeting, and I hope the panel don't mind, is any inspirational reading examples, links that we can circulate to give a bit of a follow-up email to the attendees. That would be great. And I'll also give another plug for the digital download briefing that was published this morning on behalf of NHS Providers. I think just to sort of make some summarising comments, some of the things we heard today. taking that holistic approach, noting that those who are digitally excluded are also most likely to be socially excluded. So thinking holistically, strategically, and in a partnership way. Purpose being really important. Why would a patient use your digital services? When will they use it? What are their goals? And understanding that. I think, as I mentioned, partnerships, just really being clear that this is a shared agenda. It's not all about the NHS. It's working across partnerships, across your ecosystems, and taking that place-based approach. We talked as well about not making assumptions, and users will constantly surprise you about the way they interact with your services. So having that research and design element, working directly with patients to understand where they are able to use your services or not, or could be excluded from them, and noting that actually low tech leaps forward could be just as effective as anything high tech, and is a good place to start. And we had really fantastic practical advice around being really bold but starting small, building that trust, iterating over time, but moving from that pilot to project to being really systemic about the way that you address this topic in your transformations, and finding the people in your organization as well who really get it, and engage them on changing things sustainably for the future. I just want to say huge thanks to the panel for all of your insights and for joining us today. Really appreciate it. If we were in a physical setting, I'd be leading everyone in a round of applause. So I'm sure you can show your appreciation with the reactions icon, attendees. But thank you so much for your time. Thank you to all the attendees for coming. And we'll give you a bit of time back before, no doubt, you're on a different meeting on a different technical platform probably as well. Have a good weekend, everyone. Thank you very much.
Thank you, everybody.
Thank you.
Bye.